Hello, my name is Sage Voss. I am a sophomore majoring in biology. The topic that I have researched is prescription drug overdose. I'm interested in this topic because I plan to have a career in the medical field, and it will be important for me to understand how I can minimize harm caused by prescription drugs. This topic is important to discuss right now because the number of deaths associated with prescription drug overdoses has been increasing in recent decades. Pharmacies output large numbers of opioid prescriptions, and citizens also illegally manufacture synthetic opioids, which has established a market for misuse of the substances. The addictive nature of the drugs makes it important to break the habit even before it starts. Furthermore, public health measures with regards to opioid addictions and prescription drug overdoses need to be increased to save millions of lives in the future. Drug overdose is defined as the event in which a person takes enough of a drug or combination of drugs to have life-threatening consequences. A person does not have to die for an incident to be considered an overdose. However, many people don't receive the necessary medical attention and they die as a result of the overdose. Opioids are a type of highly addictive pain-relieving drug that were responsible for over 70% of drug overdose deaths in 2019. It's also important to note that many drug overdoses are accidental since opioids are so addictive and since they are responsible for pain relief. People use the drugs to escape their pain, but in a large enough quantity, opioids can be deadly. The problem of drug overdoses and the opioid epidemic are important right now because the numbers are trending in a dangerous direction. From 2000 to 2014, drug overdoses increased by 137% and opioid overdoses increased by 200%. In 2014, opioid overdoses were responsible for 61% of all drug overdose deaths, and as I discussed in the previous slide, they were responsible for over 70% of drug overdose deaths in 2019. Just in those 5 years, there has been almost a 10% increase in how many drug overdoses involved opioids. Also, according to law enforcement, there's been a noteworthy increase in illegally manufactured synthetic opioids that are available for purchase. This indicates that in order to reduce opioid overdoses, measures need to be taken to decrease illicit opioids through illegal channels. Public health measures aren't enough to solve the issue because people will still manufacture their own opioids and allow Americans to overdose on the substances. Even with the rapid increase in synthetic opioids, which doubled from 2013 to 2014, natural and semi-synthetic opioids are still responsible for more overdoses. More specifically, oxycodone and hydrocodone are prescribed commonly and are the deadliest opioids in distribution today. Drug overdoses affect a large number of people in the United States. In 2019, 70,630 people died from some form of drug overdose. Even more alarming, also in 2019, a total of 10.1 million people misused prescription opioids. Careless prescriptions can lead to the development of opioid use disorders, of which 1.6 million people suffered in 2019. Drug overdoses are known to affect sick individuals more than healthy individuals because they develop an addiction or dependence on opioids in order to treat a disease or recover from sickness. Therefore, this group should be identified and prioritized when attempting to limit the number of drug overdoses in the United States. Also, drug-involved overdose deaths are more common in men than in women. Drug overdose is a public health concern because it can be prevented with an increase in public health measures. For example, the Connecticut State Department of Public Health has created an app, Naloxone Plus Opioid Response App, also known as NORA, to improve opioid overdose awareness and responses among citizens. The app highlights how naloxone can be used after a drug overdose to potentially save a person's life. This is an example of a tertiary prevention strategy because it aims to minimize the damage after the drug overdose has already occurred. The state has also launched an initiative called Change the Script, which aims to raise awareness of drug overdoses and treatment options such as naloxone. This promotion is done using social media, billboards, television programs, and pamphlets. This is a primary prevention strategy because it prevents drug overdoses from occurring in the first place. There are numerous methods to reduce the number of drug overdoses each year in the United States. Increases in the availability of therapy would help Americans feel less dependent on opioids to avoid their struggles. Support groups are also critical for people who are recovering from an opioid overdose. These tertiary prevention strategies help people recuperate their regular lives after a drug overdose. With a proper support system, they are less likely to regress to their former habits and more likely to move towards a healthier future. A potential secondary prevention strategy is for doctors to regularly screen their patients for what medications they are taking. This will allow the doctor to identify people who are at risk of accidentally overdosing on an opioid that they are taking for pain relief or because of an addiction. Further action can be taken to reduce drug overdoses in the United States. Interestingly enough, people can be on the path to an eventual drug overdose before they are even born. If a mother is on opioids before her child is born, the child is likely to suffer from withdrawal syndrome and become addicted to opioids later in life. For this reason, it is important to identify whether opioids are likely to fall into the hands of pregnant women. One way the government has taken steps to prevent misuse of opioids is with prescription drug monitoring programs, also known as PDMPs. Unfortunately, these programs were found to be largely ineffective at reducing drug abuse. David Fink and the researchers he worked with discovered that PDMPs show no positive associations with a decrease in non-fatal or fatal overdoses, and that they may even have unintended consequences. Therefore, it is important for the government to look into new strategies to combat the opioid epidemic, or they need to reevaluate why PDMPs aren't working to decrease drug overdose incidences. Drug overdoses and the opioid epidemic are substantial problems that are only getting worse in the United States. However, the issues are rooted in the society that we've created and can be solved by reanalyzing our own institutions. The amount of opioids that are distributed by pharmacies has created a steady supply of dangerous drugs, which allows for overdoses to happen so regularly. It has also created addiction in vulnerable individuals and encouraged the illegal manufacturing of opioids as a way to make money. With a strong foundation from public health organizations, there are solutions to reduce the number of drug overdoses each year. The urgency of the epidemic demands creative and effective solutions. Manufacturing of opioids can be decreased, increased restrictions on distribution can limit misuse, and law enforcement can inhibit illegal manufacturing of synthetic opioids. Thank you for listening to my presentation. Here are the references that I used for my research.